everybody. Welcome to ABA Inside Track, the podcast that's like reading in your car, but safer. I'm your host, Robert Perry Cruz, and with me as always are my fabulous co-hosts.
What up, fools? This is Jackie.
And it's me, Diana. Hello.
Hello. It's like I'm here with the Slim Jim, Randy Savage.
Slim Jim!
Oh, man. You can see the waveform on that one. Yikes.
Nice.
Wow. I feel like I'm bringing like a low energy and you're screaming into the mic over there. That's great.
Nonsense.
I'm
Good
bringing
stuff.
it. I'm bringing it into the Febs, into the Februaries.
It's not February right now, though.
Yeah, but it will be when people listen to this.
Won't it be January when people listen to this?
it'll
Is it
be
We
February.
just had this conversation.
What are we doing?
It'll be
In
February.
Oh, okay.
My favorite month.
Well, you probably want to know the schedule for this podcast you're listening to. It's not a podcast about schedules.
I wish
It is
it
a
was.
podcast that has a schedule, but it is about behavior analysis and behavior analytic research,
Yeah.
where every week we pick a topic and discuss relevant research articles. What are we doing in any given week?
What are we doing?
We're just we don't even read these articles, I think. We just have a
That's so-
schedule and we
that's not
throw them in a
true.
pile. No, we do. We read the articles, we discuss the articles. And this week we are going to be discussing a topic, and that's actually the name of the episode. If you're looking, it's a discussion episode. It's a discussion on neurodiversity. So we are going to be talking all about some papers related to the topic of neurodiversity and behavior analysis. We originally had some other articles, but you know what? This was a topic that while we were having a pre-discussion discussion, we decided we could have another follow-up episode another time. So for this one, we're just going to it's going to be a little looser, a little bit more discussion based than some of our other episodes where we dig into the research. But again, our articles of discussion are discussion articles. So I think it works out pretty nicely. Anyway, what articles will we be discussing?
Yeah.
Diana?
So our plan at this current moment in time is to discuss 2 articles for this episode. Like we just said, we have more. It's not as though we've ever gone short on this show. So I don't think I even need to say, if we need some more time, we'll add the 3rd article, because that seems like, I don't know, a 99.9% unlikelihood of that occurring.
And
so
if we did, I don't think we'd tell everyone we did it. We would just add it back into the discussion and then seamlessly edit it all together.
I mean, so far this has been completely seamless, and there's been no evidence of any
No.
behind the scenes
No edits.
discussion,
we don't have any-
confusion,
No
we don't-
edits.
or
we don't-
anything.
We don't even do behind the scenes. There's no behind the scenes.
It's all out there.
We're
It's all on
uncut.
scene. Yeah. So I think probably just these 2 will be sufficient. So let me tell you what they are. The
Tell
first,
me more about your thoughts about what we should be talking on this episode that is currently being recorded, Diana, please.
I actually do have a question I'm going to ask you guys in a minute.
Wait, what is this topic again?
Okay. So the articles are serious, and there's like so much to unpack and discuss related to these. So I'm excited to get started. The 2 articles are They Have a Voice, Are We Listening? By Veneziano and Shea. That was published in Behavior Analysis and Practice 2023. And also Applied Behavior Analysis and the Abolitionist Neurodiversity Critique and Ethical Analysis by Graeber and Graeber. And that was published in BAP 2023.
Wow.
Yeah,
These are
just
recent.
last year.
Just last year. It was a whole year ago these articles got published.
Now, these are very recently put out, and I'm so glad that they were, so that we can now have this type of conversation and sort of help to push some of this discussion and narrative forward into our field.
Mm-hmm.
Seems needed
Yes.
based on the intros of both of these articles being like behavior analysis doesn't talk about this
Yes, exactly.
except on social media and or blog posts.
I don't know if that's...
I think it's true. There's only 5 published articles.
Well, published articles is a little different then, because I feel like we went to at least 2 conferences it was a whole year ago in 2023 that we went to these. So it was a long
We
time,
were
I
young
guess.
once.
But neurodiversity and discussions sometimes by keynote speakers were on the subject of neurodiversity. I found them very fascinating. I'd like to think that others were similarly interested in continuing this conversation. So I can't believe this is going to be, one of those episodes where everyone's like, what, neurodiversity? I don't think that's a topic of interest. Delete. I think this is one
I don't think
there's
that
room
is-
for
yeah.
a lot of talk.
I don't think we're there,
Mhm.
but we're also not to the point where like everyone knows what neurodiversity is,
Mhm.
right? Or is accepting of neurodiversity.
Oh, we're definitely
Right.
not at the point where people are fully accepting of neurodiversity. There's a lot of things that I would say as a society we're a little bit short on the fully accepting of.
Yeah. So that's why we need to talk about it.
Great.
Boom.
But as we all know, research tends to lag behind what the current conversations might be because it takes a long damn time to get an article published.
Mm-hmm.
Oh, now we have to make this explicit.
No,
I'm
not
just
putting it-
kidding.
Oh,
Swear to
I was
your
like,
heart's content,
explicitly-
I'm
everybody.
just kidding.
explicitly what?
I know. You're
even-
like, what are you talking
that didn't
about?
count.
We are really talking about neurodiversity.
Exactly.
Let's make it explicit.
So I would anticipate this will be a continued conversation within our field, but it is true that if we are looking to our peer-reviewed published journals, there's not a ton out there that references neurodiversity as of yet. I think these are important conversations that are going to continue in the field. So we're pulling from these 2 articles just published last year because they are a good place for this conversation to start. And we already said we would like to continue this conversation in other veins in the future. So hopefully we can get to some more articles.
I just found a huge blue fuzz in my mouth. And I
Yes.
think
Well, it was on your microphone, like
and
foamy
then I
bit.
ate it.
and then you put your lips right on there. I watched it all happen. I just didn't comment
You're
on
the
it.
worst.
Your mic technique, Jackie. You're screaming into the mic. You're kissing the mic. Gotta work on this stuff.
Well, it is a new year. New year, new me. Snap-a-doo Slim Jim.
I figured it would all work itself out, and it did. But the listeners also got to hear about it too.
They're having a great time. They really feel like we've broached
Yeah,
the
so-
subject we promised them in the title of the episode.
So some people might want to start things off with a quick definition related to neurodiversity. Do you think we should start there?
No. Yes, of course we should.
okay,
I was
like-
being
I
sarcastic.
know. I couldn't tell if you
Whoa.
both said no simultaneously.
I did sound like that, but I did
Oh,
not.
I wish we had. That
Yeah,
would have been
me
a funnier
too.
bit then.
One yes, one no. I
No,
vote
yeah, we
yes,
definitely should.
So we rule by majority vote here. So since that's the case,
I was kidding. I was kidding with the no.
I know you were
All
just
right.
joking. It was hilarious. So just to let you know, the term neurodiverse and neurodiversity are not diagnostic terms, right? So you're not going to find those terms specifically in the DSM. And rather, they are terms that were coined by a sociologist named Judy Singer. She was autistic, and she introduced this term in the 90s as a way to talk about differences that we might see in either brain neurology or behavioral presentation based on that neurology that can steer us away from a conversation that's solely focused on the deficits that are listed, for example, in the DSM as related to various diagnoses. So depending on where you look, you will see different things listed underneath the category of what might be categorized as neurodiverse presentations. Sometimes my favorite one is like a little umbrella. And I don't know, it's like a cute graphic. But you can search around and see lots of these around there on the internet. So lots and lots of things may sort of fit underneath this umbrella that constitutes a neurodivergent presentation. Most commonly, we see diagnoses listed under there such as autism, ADHD, and learning disabilities such as dyslexia, dysgraphia, dyscalculia, for example. However, other things could also be listed underneath this umbrella, things that either are present from birth or are potentially acquired too. So you'll also see brain injuries listed underneath this umbrella. You will sometimes see other things that we might categorize in the mental health department, such as anxiety or depression, et cetera. The list can go on, bipolar, et cetera, et cetera. So depending on how big the person decides to draw the umbrella, you might have lots and lots of things underneath here. I am not going to tell you what does and doesn't categorize as falling underneath the umbrella because there is no set rule on what is underneath there. But the idea here of neurodiverse, well, let me just say, the idea of neurodiversity is separate from the neurodivergent umbrella that I'm describing. So the idea of neurodiversity is just like biodiversity. We come into this world with lots of different genetic presentations. We come into this world with lots of different neural presentations as well. One over the other should not be valued more or less, but rather we all benefit as a society from this variety of presentations that we bring. Some people bring some strength in some areas, others bring them in other areas, and our species as a whole benefits from this type of diversity. So that's like the term neurodiversity. And then from there, the term neurodivergent would be in contrast to what is sometimes called neurotypical. So if you're kind of part of the majority, then your brain operates in the way that is expected by society. And if you are neurodivergent, then your brain operates in a way that is different than what might be expected by society. That in and of itself may or may not impact you in this, that, or the other way. It's really person dependent on whether you see those differences really present themselves as disabilities in some areas or not. So a neurodivergent person might identify as having autism or ADHD or learning disability or some type of mental health issue, etc., on down the line, right? Okay. And then I also want to distinguish as well. So I talked about the term neurodiversity. Then I've talked about the term. So neurodiversity means we have lots of different brains, right? Then we have neurodivergent individuals and neurotypical individuals. And then we also have the term neurodiverse. So a neurodiverse population means that we have lots of different people within that group, some of whom would identify as neurotypical and some of whom would identify as neurodivergent. So I wanted to sort of distinguish between those different terms. And then I got off track talking about Judy Singer, but I wanted to bring it back around to her as well. You know, she liked using the terms neurodivergent and neurodiversity to really highlight strengths of individuals, particularly, as I said, she was autistic. So looking at the autistic population. So thinking about the strengths that might be presented by having strong ability to focus, for example, right? Or a strong pattern recognition, remembering factual information. This, of course, is independent of each person, right? You see sort of variations there, but those were some things she wanted to highlight. And then the journalist Harvey Bloom also worked closely with her, and that he kind of helped get her message out. And he wrote about her work. So he gave us this quote too. It says, neurodiversity may be every bit as crucial to the human race as biodiversity is for life in general. Who can say what form of wiring will prove best at any given moment? And then it was the late 90s. So he was very focused on thinking about what he's calling cybernetics and computer culture. We've sort of moved on from those terms as well. But the term neurodiversity has continued to pick up steam, and you hear it more and more now than maybe you did previously. So if you kind of parallel it to biodiversity, I think that's the best way to get a handle on what it might mean. So that's a little background there on the term itself.
So before neurodiversity was coined, there was the disability rights movement, and that originated in the 60s and 70s in the UK and in the United States. And that movement was brought upon to challenge the notion that if someone had a disability, that made them lesser or bad or worse than someone that didn't have a disability. And so that disability movement allowed, I think, for the neurodiversity movement to come about too, right? Because then here we can say like a disorder such as autism is not bad, but it's just different, right? So we have different strengths, different weaknesses, but it's not something that makes you lesser of a person or less worth of a person if you have this disability.
Yeah. And some people prefer to not use autism spectrum disorder as well. You'll see autism spectrum condition sometimes in its place because the term disorder, of course, is, housed within that medical model that's really looking at it from a deficit perspective.
Right. And so when you're looking at autism and autistic individuals' life experiences, how you look at it will be how you talk about it. So the authors in my order, Graeber and Graeber, totally married. Love it. I looked them up. I stalked them on the internet. I'll talk about them in a little bit. Unless they're brother and sister. I didn't find their wedding website, but
you can go to the knot.com and type in Graeber.
That would be so weird.
That's the kind of prep we do on this show.
But not beyond me. And if I had a little more time, it's not, right? Be like, and they live at this address. But when quality of life is not good, so we've talked about quality of life in episode 165. It's not because a person has autism that their quality of life is not good, right? So that it is because of the interactions with the environment and the environment surrounding the autistic person that's not supporting their quality of life.
So you're talking here about the social versus the medical model.
I was getting to next, girl.
I'm sorry.
But you do it.
No, you can go ahead.
No, go. I want to hear it.
Okay. So the medical model of disability, chances are, if you, dear listener, are a psychology bachelor's degree and you went through ABA school, then you are well steeped and well versed in the medical model, whether you realize it or not. So our entire medical system and our entire psychiatric system is based in this model, which is you, patient, tell me what's wrong, right? And I will then consult with my big book and find something that matches, that also says these same things are wrong. And in doing that, I'll then have a diagnosis for what is wrong with you. And the whole point of our interaction is that I fix what is wrong, right? Like
there's so many things wrong with you, but how can we categorize your wrongness is kind of how that works.
Yes. And from a physical perspective, like if you go to the doctor and you say, I have this pain, right? You want that diagnosis. You want to know what is wrong so that it can therefore be fixed. And this model is not entirely broken or wrong. But when we start to get into these areas where we say, well, you were born with X, Y, or Z, quote unquote difference, and it's behaviorally being presented in this way, we really get into some gray area on whether that is how we should then be interpreting those differences as a said disorder, and whether the best thing to do is to eliminate those differences and thereby, quote unquote, fix the person from said disorder. So that's the medical model. The social model of disability operates differently than that. So rather than saying these things are listed here as a deficit and I'm going to, make you quote unquote better by alleviating these deficits, rather they really are looking at disability as an interaction between the person and the current environment in which they are in. So we're not saying that disability doesn't make life harder for some people, right? And disability is not a bad word either, right? It's not bad to have a disability, but it tells you something about what life might be like for that person in certain settings. So if the interaction between the person and the environment is such that we could make that person's experience better by making changes to the environment, right? Then it's not that the person has a disability, like it lives inside of them, right? But rather they are disabled by the current situation that they are experiencing. There might be ways that we can make that situation better for them. So we can make accommodations and changes to the environment, both the physical environment and the attitudes of society that we all live in, right? That could make that person's experience better. We can turn down the lights in the mall, right? So it's not so overwhelming.
Specifically Walmart, let's be honest. I can't even go into Walmart. It's so bad in there.
Yeah.
Every time one time somebody made a bet with me and they're like, if you lose, you have to walk into Walmart and stay there for 20 minutes. I'm like, I might die. It's so bright.
Yeah.
I lost. I didn't die, but it wasn't nice.
These lights are so loud.
Yeah.
Right? I'm like that at the mall, but Rob already knows that I can't go to the mall.
No.
But it's the people.
You don't like crowds.
Yeah, it's the people.
I love them all. I'll go with you, Rob.
Okay. That's good.
We can hold hands.
Right. So the idea here is that we should be analyzing what a person's current environment looks like, both the things we can physically see and sort of the cultural barriers that may be in place, to determine what can be accommodated and or alleviated such that that person is less disabled in that particular environment.
Yeah. And the only thing I want to bring in that discussion is that it is common that applied behavior analysis, or ABA, has been associated with the medical model, right?
Oh,
and
yes.
that is not surprising at all because we bill insurance. We're supported by the CDC. We're supported by the American Pediatrics Association. I said that weird.
Nailed it.
I was saying it New England-y. An association. Right? And so how we write our objectives is very medically driven, right? We talk about when we write our objectives in terms of deficits a lot of the times and not strength.
These are all requirements also by insurance agencies and reasons that we can't often work with someone without that particular diagnosis, despite the fact that what we do could be applicable to lots of different populations.
So I think when we dive into Rob's article in a few seconds, and the first couple paragraphs are not ABA is the best.
That is the first couple paragraphs. Actually, that is my note. First page equals ABA. Isn't it just so great? That's pretty much the first page of that article.
But but there are, when you're looking at it from a client point of view, when you're looking at the objectives, they aren't positive in a way that
written as a positive,
right?
How I as someone supporting you is going to add to your skill
add to your
set,
life,
add to your life, add to your quality of life and happiness.
Yeah, it's like, here are your deficits based on this medical model, and here's how I'm going to fix you.
Yeah.
Right. And so that, I think, does lead us into a realm of some people saying that ABA should not exist or does not support the neurodiverse movement.
So we've got a couple general things going on here. We've got the increased rise and voice, which we're all very happy for and champion of individuals who associate as neurodiverse, being able to advocate for what services they do want, what skills they do want support with. More and more people seeing autism, as well as a number of other categories that might go under the neurodiversity umbrella, as a mere it was like a mere difference rather than a bad difference.
Yeah. Yep.
Yeah. And certainly I think as a society, certainly Western society, there is this sort of myth of the norm of this is what most people are like, therefore this is good. And if you're outside that norm, you are somehow bad or different. But when you say different, you really mean bad or weird or could you please leave the rest of us normies alone sort of categorization. So
which we don't agree with.
We don't agree with.
Rob
That is the
being
hypothetical
facetious. Yes.
middle ground. But I think there is sort of a culture of there is a right. And you're either in the right or you're not. And if you're not in the right, that means something's wrong with you. And therefore you should do something to respond to that deficit so you can join the rest of us. And I got air quotes going with the rest of us.
Yes.
As opposed to this idea that there is no norm outside of sort of statistical models of a variety of things based on bias tests that have been created a long time ago. And there may be sort of a majority or a mean looking at certain values, but none of that should ever be value in terms of like the capital V, things that are important so much as like, well, how might you want to budget certain things because this many people might check this box on an assessment. And again, I don't want to say that there aren't a lot of problems with using that, but there's no magical norm. And I think a lot of us started this career, well, maybe not a lot of us, was 60% of folks only in the past 5 years or so became BCBAs, but many of us old timers, we really came in where ABA was, if you weren't in the medical model, you probably didn't have a job to go to. So this was
I think that's even worse now than it was then because there weren't insurance funded services.
Oh, well, it's a different worse then.
Yeah. And what you're speaking to too is the inherent ableism that is built into and baked into our society.
Yes.
And if folks aren't familiar with the term ableism, then that is really discrimination based on disability.
Mm-hmm. So I think we have a lot of contexts that work against having a meaningful discussion in this area. And I think a lot of folks, if you ask them about this, certainly would not want to engage in discourse or practices that could harm or minimize the needs or struggles or skills and benefits of, working with different individuals. However, if you challenge anyone's ideas too much, I think, Dinah, they're going to go back to that kind of ableist mentality, whether they know they're doing so or not, because that is just how a lot of us were brought up. So we have a lot of context we're working against, and I'm glad we can have conversations like this and in a space like this to move forward with what ABA is and how it is perceived.
And how it can get better, potentially.
Well, it definitely can get better. I'm not worried about it getting better. I think the concern that I know I have heard and the concern that I have is that are we going to have the time to demonstrate that better or to ally with groups that do not see science of behavior as worth saving or worth following up on?
Well, right now we only have 50 minutes. So.
Okay. 50 minutes. Come on, Dan. You listened to this podcast before. So I'll talk a little bit about Veneziano and Shea, which overall I found to be an interesting article. It had some really nice points. One I really want to keep coming back to is this idea of indistinguishability as a component of many behavior analytic treatments through the historical lens. I think they circled a lot of points well. I don't know if they necessarily drove home every single one, But content-wise, I think there were definitely some areas that were very strong in this paper and others that I felt they brought in and then kind of moved away from some of the discussion points, which
okay, review or two.
you know, some of it
review
too
or two.
is they did have huge sections where they discussed for a long time some subjects we've brought up on this podcast a lot. So ethics regarding conversion therapy.
Just wait for pairings.
So I think some of that might be, your mileage may vary because unless you've done multiple podcast episodes on conversion therapy and ethics of some of those Rutgers et al. Studies, you may have different thoughts on what they did or did not add in this paper that they could have or should have had.
You're speaking to an audience of 3,
An audience
I
of
believe.
3, 4. Well, we had some guests too. I think we had Alan,
yes, that's true.
Werner was so maybe it's not just an audience of it's like 5 or 6 people maybe who might be in that same boat.
Like we said at the top, like there are very few articles out there that are looking
5.
at neurodiversity. I thought it said 9.
I think it's 5.
5 was cited. There may
I
be,
don't know why I
there
came
may
up
be
with
9.
9
Some
then.
maybe we got some early published ones. I did not
Either
check.
way, you can count them on 1 or maybe 2 hands.
Yeah.
But there aren't very many right now. So everyone has a lot of ideas they're trying to get down on paper. For me, I thought that the most critical takeaway from this article was that indistinguishability idea, which you're going to come back to. But they also wanted to pull in parallels for past psychological groups and then past behavior analysts, right? So people had places to kind of point of reference for where we should move forward from here.
Yeah. I mean, it definitely read like a paper of, we only have 5 of these papers, so I want to cover more, but I can only write so much. So here's what I got. And it's good, but it's not going to cover everything that I think one would want. So again,
it was a great paper.
Good in many ways. So, you know, one of the areas I think some folks who might be sort of new to the idea of the neurodiversity movement and why do people not like ABA, you're going to hear some of those kind of classic arguments of a lot of people don't like ABA because it usually teaches skills in this very rote, robotic way, and it doesn't generalize very well because everything's learned at a little table or a little cubby area. And you know, everything's 20 hours a week. Why is it always 20 hours a week? And why is everything about you have to do what I say and don't do what you're interested in, client? I want you to do my color matching activities or name, what do the animals say activities, right? And that certainly is a potential critique of ABA. And I think we've read other articles in the past. And I'm so happy neither of these articles fell into the trap of, here's what you should tell people when they tell you that ABA isn't good. Because I think that would defeat the purpose of why we would be having discussions on neurodiversity would be like, let's start by saying, how do you defend yourself? Because as we all know, the best way to join a group and having a meaningful conversation is to get super defensive and to say how what they're saying is wrong and how you actually don't do the thing that they're saying has happened.
You want to Miss Piggy that conversation.
No. That's not really a great way to show that you are interested in a meaningful conversation. It's, no. It's not like that anymore. We don't do that anymore. Yeah, that's
whatever, frog.
So really briefly, those points, again, we've had lots of research since then looking at, everything doesn't have to be discrete trial training. And there are lots of great ways to do generalization. When we talk about like general case analysis or pivotal response training. And like, I think, the modern behavior analyst is all about individualization and client goals. And how do we help clients reach their goals and families reach family goals, which of course is going to require a high level of individualization. It's not just about what we think is the best to learn. It's about what is valuable and meaningful to the client. And so there we go. Problem solved, right? And you know what? If those were the only critiques of ABA, I guess, yes, problem maybe, mostly solved or in the right direction. But the challenge is, again, that indistinguishability. And Veneziano and Shea then really go back and they say kind of what is the key challenge and where are some of the sort of key areas of research that have so many individuals who are advocating for themselves within the neurodiversity movement really crying for an end to ABA or the trauma caused by ABA. And certainly we could be talking about some individuals. I know certainly punishment procedures have been used in the past, but we're not really talking about, because I think that would make it an easy conversation of what are the ethical things that weren't as ethical problems then in the sense of society was cool with them and now we wouldn't be, right? We're not just talking about procedural changes over time as society as a whole has sort of moved on and learned new lessons and decided to, rethink some of our values. We're talking about kind of a core component of many of the possible treatment models that exist around the support of autistic individuals, namely that idea of indistinguishability. So the definition
as a treatment goal.
Yes, or not even as a specific goal, as an explicit goal, but as sort of a subtle goal that goes into most programming or much programming.
Sure, like goals are selected based on perceived normative outcomes.
Yeah.
So like if only we could get this person to look like the rest of their peers, then our job is achieved.
Yes. So indistinguishability, the definition in the paper, and this is a quote, how two or more people, items, or constructs that may be different but generally are not identifiable as such, or more behaviorally precise, two or more stimuli evoke behaviors within the same response class that result in organism emitting functionally substitutable responses in their presence, or if the stimulus is also an organism, due to the stimulus's properties when in their presence, end quote. So basically, the idea of two, we're talking about two people being, responded to exactly the same way because their behaviors are similar enough. And we certainly can look back, and the Veneziano and Shea do look back at some of sort of the bigger studies that are often critiqued when talking about ABA, which would be Reckers and Lovaas 74. We've talked at length. That is the experiment in which Kirk was taught to engage in more masculine behaviors and stop engaging in so many feminine behaviors, or as colloquially a lot of people refer to it, the sissy boy experiment.
Oh,
That's
you should never
terrible.
even say it.
Don't even.
Okay, I mean that's from the article. That's not what we referred to it as, but that's sort of the old term for what went on in that experiment. So basically, it was sort of one of those early studies that used a number of behavior analytic techniques to change the behavior of a boy who was engaging in what at the time, or what were considered to be, gendered behaviors that his parents did not like, and they wanted him to act more like a little boy and do boy play and play with guns and army guys. And this study is often cited as sort of one of like the big precursors to further work on conversion therapy. The other study they bring up is Lovaas. Again, Lovaas is really getting a talking to in this article. The 1987 article in which sort of ABA came to the front of, look, when we use ABA with autistic students, 47% of them in the experimental group who received ABA treatments were back in their first grade inclusive schools and had an average or above average IQ, which was very different than the control group, which only 2% reached that outcome. So this was sort of the big study of ABA can make your autistic child, quote unquote, normal and indistinguishable from their age-matched peers. So while I think we have hours of us talking about the idea of Reckers and Lovaas as an unethical study that would never be, wasn't appropriate then, not appropriate now. We haven't really talked a lot about Lovaas 87.
Because I don't want to.
And certainly we would be able to say a number of areas that could use a lot of improvement with that study that were based in sort of what was known or what was acceptable at the time in science. The big issue here is not that like one of these is really bad and one of them is sort of historically not looked on as well. It's the idea that the goal in both of these was to use behavior analysis to teach individuals to engage in behavior that made them indistinguishable from their peers. So even though we would all say goals like being able to be educated with peers, being able to access social opportunities with your age-matched peers would be good goals. Are they good goals if the way to go about this is to reinforce behaviors that are just like everybody else's, even if those are not behaviors that would be chosen by the clients or the participants of the study? And this, article goes on to sort of discuss, who are our groups? When we are trying to figure out what are meaningful goals, who do we talk to? Are we talking to the client? We can't always talk to our clients because some of our clients struggle with communication or cognitive ability, and they may not be able to have conversations, I think, the way that would be easy to say, hey, do you want us to work on this? Yes or no? And there are certainly ways around that. We use concurrent chains, procedures, we can do preferences, and there's lots of ways to do that. Are we talking to the stakeholders, the parents? Well, certainly we want to be doing that. However, when we go back to Reckers and Lovaas, the parents were in agreement with indistinguishability being important for their son.
Yes.
So they were, maybe social validity wasn't super high for mom or for siblings, but it was pretty high for dad. He liked all these procedures because he wanted his son to be, quote unquote, more like a boy. And then we sort of say, okay, well, what about, and this kind of came out from the 70s studies, what about talking about the greater community of which some of these individuals were a part of? So, for example, for Kirk, the LGBTQ plus community, about what are meaningful goals for that group. And if we're not engaging with all of these individuals on some level as stakeholders, how are we to come up with goals and objectives that aren't focused on a goal of creating indistinguishability? And certainly for our field, that is a key concern. And when it comes to listening to the neurodiversity movement, including both our clients and stakeholders, as well as members of the larger community, is going to be important, because if we don't, there's a chance that even though we think we're doing what's best for our client based on what they seem happy with, what their family seems happy with, may still be leading towards goals that promote an agenda of trying to normalize or create indistinguishability with our clients, which would not be serving us as a field, would not necessarily be serving our clients, stakeholders very well, and certainly would not be serving the goals of a diverse group of individuals. Now, one of the challenges, and I think something that is not exactly missing in this article, certainly they do a lot of talking about social validity, what's social validity, who decides social validity. Certainly it's everybody outside of us and our field deciding social validity is where social validity comes from. It doesn't come from us internally in our field saying, these are the socially valid practices we all agree upon. That's for others, the people we serve, to tell this is or is not socially valid. Though it's not always that easy because, again, Records and Lovaas, there was high social validity from a lot of people for that study. Not from everybody.
Yeah.
But from some individuals, there's a lot of social validity for Lovaas 1987, certainly at the time, and possibly even today. I think there's still probably pretty high social validity.
And then can I just jump in and break down the ways in which Wolf 1978 talks about social validity? So he really breaks it into 3 parts. The first one is how acceptable are the goals that we've set forward for the client, to the client and other stakeholders. The second one is how acceptable are the methods by which we are attempting to achieve these goals for the clients and stakeholders. And third is how acceptable is the overall end result or outcome to the clients or stakeholders. So at any of those 3 points, there could be a breakdown between what the behavior analyst is proposing and what the client or stakeholders finds to be socially valid. And I think in these cases, we could potentially argue that there are points of breakdown on all 3 of those pieces of social validity for the examples here that they are putting forward.
Mm.
So it could be an issue between what, society at large views as an appropriate goal and what the client sees as an appropriate goal. Because if we're choosing something that's based in a normative sample or is basically an ableist, what was the word? Sorry, indistinguishable goal, right? Then that's problematic. If we're looking at the methods by which we are attempting to achieve that goal, there's a whole host of challenges presented there. We're basing things in, behavior modification strategies. We're basing things in aversive control. Like, these are problematic. And then finally, if people are not satisfied with the outcome, looking at long-term, specifically outcomes, right? Then there's a problem there too. So this article, I don't think talked about the term masking.
They brought it up. They referred to it as camouflaging a couple more times than masking.
I didn't remember that distinction in the terminology, but it's getting at the same idea here, which is if, we can teach people to act a certain way. Behavior analysts are good at teaching people to act a certain way. But if they're doing it just to please other people, right? Or just based on like momentary contingencies, we're not going to see that behavior generalize and maintain. And even more so, we're only going to see that behavior within that particular context at potentially great emotional and exhaustive expense of the person who's engaging in it. So they can, if you're being asked to make eye contact or sit still in your chair or not engage in hand flapping for an extended period of time, you can do it, but it's really hard on you and it's exhausting and it makes that entire environment potentially aversive. So we really want to be getting that information from people on each of those points in time. Is this a good goal? Is the way we're trying to do it good? And are you satisfied with the outcome that you're getting from it? And without that, sure, we can change behavior, but we are not doing so in what should be the ultimate spirit of helping our clients.
Mm-hmm. And the article kind of goes on to give some good suggestions for the future, which certainly include more education as to the disability rights movement in ABA programs. Like, wholeheartedly agree. That's very important. Also looking at how the disability rights movement mirrors many other movements that have supported increased honoring of the rights of individuals from previously disenfranchised groups, from minority groups, and then also looking at how can we do better with our social validity practices. And I do see social validity as an area where, as much as it's not just about here's the Likert scale you need to use, I think really thinking about how are we using meaningful measures of quality of life, happiness. We've talked about this before on the show. I know I've heard a lot of folks talking more about this, but maybe we need to have more kind of concrete, specific banks to pull from of like, these are good things to do. If you don't have a lot of time for social validity, at least do these things to ensure that your client and stakeholders are in agreement with goals. And I think that's true also for practitioners who are working in different organizations where they may not have the same contact with stakeholders, or they have multiple stakeholders, because at the end of the day, while we usually say stakeholders and it is interchangeable with parents or guardians, stakeholders can include other individuals depending on what your relationship is to the primary client. I work in schools. So who are the stakeholders?
Sure.
Well, I know who my client is. It's a student I'm supporting. But who are the stakeholders? Well, teachers would be, school administration might be, other students maybe, the parents certainly. But I don't see the parents because I'm in the school where parents aren't always there. So they still count as stakeholders, but it's a different relationship than, say, if you're doing in-home EBA services. So I think maybe more clarity with this is how social validity can be done, and certainly more advances in the technology of social validity are very important. And at the end of the day, I think this paper says a lot of really great things. I wish they'd focused more on that idea of indistinguishability. I feel like they did, and then they sort of circled around it and they started bringing up other examples. And then I really wanted them to get into the nitty gritty of how do we determine when we are or are not working in the service of indistinguishability. And I know an area that I had some questions on had to do with looking at a representative sample. What does it mean to look at a representative sample? Because then I think of the autistic community, and we think of many individuals who are kind of voices in the neurodiversity movement. They are advocates. They are able to get online. They're able to have a presence. But we've all worked with a number of individuals who are not going to be able to advocate for themselves quite that same way. So if we aren't looking at the needs of certain groups within other groups, are we really looking at a representative sample when we talk about defining indistinguishable behaviors and avoiding trying to create indistinguishability, right? So I think that it doesn't muddy the waters in the sense of I certainly do not want to promote indistinguishable behavior in the sense of normalizing or making others feel less than some sort of perceived norm. But I think it's more complicated than just, well, the people who are talking the most or talking the most eloquently, they're my representative sample. So I want to listen only to that group. I think there are lots of people in any group who would not associate themselves as I'm only one thing. And to even just assume like, well, the person who is posting the most about this subject, that's my representative sample, which we know no one person should ever be forced or asked to speak for the rest of their group. So I think there's much more that we could do to really look at what does it mean to be promoting or not promoting indistinguishable behavior. And so I think that is definitely an area where I want to see more kind of work, and it's going to come with a lot more outreach and longer discussions about what that could be, because I think you could go the other way too. If we don't want to support indistinguishable behavior, but then we also stop engaging in certain activities that have been beneficial to certain clients, but maybe not to other clients, right? It's not as easy as don't do this, just do that.
But you know what? My article talks a lot about that.
I know it does.
So why don't we
take a break and then come back and talk about that article?
Boom!
We'll be right back.
Do you want to be a BCBA?
Sure, we all do.
Now you can come to Regis College in Weston, Mass. to get your graduate degree.
Choose from any one of these courses.
Masters of Science in Applied Behavior Analysis.
Masters of Science in Special Education.
Dual degree in Special Ed and ABA.
Or be eligible for your postmaster's certificate.
You can complete your degree and be ready to sit for the exam in 2 years. And our 2017 grads had a 100% pass rate on the BACB exam.
Come enjoy practicum placement support, ethics mini handbooks, PhD-level professors, small class sizes, and a service trip to Iceland.
If interested, don't delay. Supplies are limited. Learn more at regiscollege.edu.
Again, that's www.regiscollege.edu, regiscollege.edu. One more time, www.regiscollege.edu.
See you there!
And we are back having a discussion on neurodiversity. But before we continue that discussion, I want to remind our listeners that ABA Inside Track is ACE and QABA approved. And by listening, you can earn 1 learning credit. All you need to do is finish listening, then go to our website, abainsidetrack.com, or you can click on the link in your podcast player's show notes page and get taken right to the place where you need to enter in some key information, including some code words. What do you need to
This is
include?
going weird.
A lot of things, but definitely 2 code words. I'm going to give you the first one now. It's Mario, M-A-R-I-O. He was the star of the billion-dollar hit movie, the Super Mario Brothers movie.
You
Oh
hooked
my
on the
goodness.
brothers.
Yeah. What, you don't like that movie?
I never saw it.
Oh. I thought it was cute. It pandered to me, which I appreciate. I was a representative sample for the Super Mario Brothers movie, that's for sure.
I like Mario Brothers 1.
That is do you like Super Mario Brothers or original Mario Brothers?
Original.
Like where it's Mario and Luigi
1.
and they're in the pipes and they're fighting like turtles and stuff?
Yep.
And it's only one screen?
Yep.
Or
That's me.
Like,
Dugga, dugga.
no, that's you're thinking of Super Mario Brothers, Jackie.
Oh, I don't know. That's one I like.
Super Mario, where you're in the Mushroom Kingdom and you go from left to right.
I
You
don't
jump
know.
on the turtles and you jump on the little mushroom people.
You go to level 8.
Yep. You take the warp zone.
You morph
Yep.
it.
Exactly. It is a great game.
Okay.
Mario. All right. So when we left off, we were sort of talking about some of the further points that need to go into how we are making sure that as providers of services that we are moving away from, subtle goals or hidden goals of creating indistinguishable behavior and trying to sort of normalize the behavior of others.
And hidden often to the practitioner as well.
And that's why it's
Right?
pernicious, because I don't think I don't know if I'd ever thought about it in those terms. I certainly think I have acted more client forward as I've progressed in my career because I've gotten old, but certainly I still even in this day and age will have families that are discussing challenges with their child, and it can be hard to have conversations of that is not harming anyone. I know that it makes you upset or it's causing you stress. However, doesn't appear to be causing your child stress. Therefore, it is not a goal. We're not going to write an IEP objective around a decrease. I don't write decrease goals anymore. I hate writing those things because what is the skill that might be missing or making it hard for this individual to get their needs met? That's the goal. That's what I care about.
Sure.
So, I've certainly made those changes in my own practice, but I don't think I thought about it in terms of, and that's how I'm moving away towards trying to normalize the behavior of others.
Okay.
So let's continue on with a little bit more on, we talked a little about Graeber and Graeber. Let's talk a little bit more about some of the subjects they talk about, including the abolitionist.
Neurodiversity critique. So a little bit about our first author, Abraham Graeber, because I did some...
You did find his not webpage.
No, I did. He does have a webpage, but he is not a behavior analyst. So that is important to note, but I think his wife is. So I think Jessica Graeber is his wife and she is a behavior analyst, but he is an associate professor in the division of bioethics at Ohio State University.
So he knows all about cybernetics.
Oh, he is married to her because in his thing it says Dr. Abraham Graeber is married to the wonderful Jessica Graeber, who is a pediatric psychologist at Nationwide Children's Hospital. They are in love. By the way, I don't think she has anything about him on hers. Maybe she couldn't.
That's really funny.
I know.
Most people do not give their spouses a shout
I
out
love that.
in their profiles.
I think more people should.
Okay. They have 2 amazing young children too.
You should be required in your bio to write about what amazing animals and amazing children you have in whatever amazing place you live.
Right?
It's my favorite when I read
So
that.
they do collaborate. So that makes me feel good. So this probably was written over the breakfast table. Right?
Mm-hmm.
And they are looking at applied behavior analysis. This was probably like, how can I be an applied behavior analyst and support the neurodiversity movement and still listen to the critiques that I am getting as a behavior analyst to the neurodiversity movement.
Yeah.
Right. So in the introduction, they talk about recent research that we've talked about on this show in lots of different ways, starting questioning the ethics and safety of ABA because previous clients of ABA have said they've been traumatized, right? That they haven't felt safe. Obviously, we've had the concerns about the LOVAs. And so abolitionist neurodiversity critics are different from reformist ABA critics. So reformist ABA critics believe there is power and utility in ABA, but we do need to make some changes. Abolitionist neurodiversity critics states that ABA cannot be reformed and it must not exist, basically, should be taken out of mainstream treatment. So if you are a behavior analyst, there is no way when you read through these things, if you agree with the abolition neurodiversity critique, you probably can't be a behavior analyst.
What if I really just wanted to be out of a job?
Well,
I wanted a vacation as soon as possible.
Or I like that. So, but that's what they say. You can't be a behavior analyst. You can be a behavior analyst and believe in the reform.
I would hope every behavior analyst believes at some level in reforming the field if they've been in it. I mean, maybe the first year, don't worry so much about it. Just get
first year, you're like,
just get good at your job. It's okay.
Right?
It's okay to love what you're doing and just focus. But at some point within those first 5 years, if you're not saying there's things that could be better, something's not going right.
Right. So the National Council on Independent Living did pass a resolution, and there are a staggering amount of anti-ABA articles out there, blog posts, social media platforms, right? And so the one reason that these authors probably wanted to write this article is to expand discussion of neurodiversity in the ABA field and in the literature, and look at the concerns brought about by the abolitionist movement to see, okay, where can we work with them, right? Like, where do we see the gaps in behavior analysis, and how can we discuss the ethical and safety implications that they bring up? Yeah.
Here, I was a little confused in this article in terms of you can't be a behavior analyst and believe in the abolitionist
because it's
perspective, but then the idea of, and we need to work with them. I understand that as a goal, but it does feel like one of those things. If you can't, everything they're saying, not everything they're saying, but their essential point, you can't agree with and be a behavior analyst. But we have to work with them too, which feels like, I don't know how, if they don't like ABA, that's going to be a tall order. And while it is a goal to, I think, improve.
Right. I think they're saying if they don't like ABA, there are some valid points. Yes. So just because someone wants to completely eradicate us doesn't mean that we should just be like, oh, they just hate ABA and throw them out the window. Okay. Right. So I think what they're trying to do in this article is say, okay, here are the points. We're going to bring in 3 case studies, which I love. Very vague case studies, which I also love.
Case studies a lot.
Yeah.
And here's how someone might use these case studies to say, oh, ABA is amazing. Of course we need it. Or ABA is so horrible and we should eradicate it. And here are the different viewpoints and how can we learn from both of those viewpoints, right? You agree?
Yeah.
Okay.
So don't work with them to end ABA, but definitely listen to improve ABA in such a way that they might say, well, maybe we don't need to get rid of it fully, and they become more about reform, some percentage reform. And then we have an inroads to really make good change.
It's really not about changing other people. It's about changing yourself.
Yeah. Changing yourself for the better.
I want to change myself, and then possibly it will change other people. But not because I'm trying to change them, just because that self is a new environment in which people's behavior just changes, because that's what happens.
Quite possibly, but I really think, they published this in a behavior analytic journal for a behavior analytic audience.
Right.
So, there's a dialogue that needs to be happening within our field about this topic. And folks, it is certainly easiest to just be defensive and to try to push everything away and not think about it and keep doing what you're doing. But there are definitely pieces that we should be listening to, thinking about, and making changes to our practice. And many of those changes are 100% doable and incorporatable into what we do. It's often a matter of starting at the ground up, thinking about the culture that we are producing within our field and the ways in which we are educating future behavior analysts.
And talking about it.
Yes.
Right. And there may be some differences that are truly just a theoretical difference, right? And that's going to be a challenge. The same is true with the OT community too, right? But it doesn't mean that we can't work and collaborate with them as well. There are also going to be things that we can make changes to. And the more that we have an understanding for ourselves of the strengths of our science and the potential flawed application of that science, the stronger we will be as a community and the better base we will have to then move forward as a field into a better position to serve our clients. Your turn.
Well said.
So Jay, the case. Let's go through the case studies.
Okay, so quickly.
Yes.
Yeah, so quickly, the first case study is self-injurious behavior. Avery is a 13-year-old and had been diagnosed with autism spectrum disorder. Avery engages in repetitive self-injurious behavior involving hitting her hands or fist to her forehead, resulting in chronic bruising and occasional open wounds on Avery's hands and her head. So that's one case. And one is hand flapping in school. Alex is 13 years old, is in general education setting, and has been diagnosed with ASD. Alex engages in repetitive hand flapping that does not cause injury. Alex hand flapping is incompatible with engaging in various tasks at school. Alex parents and teachers are concerned that her hand flapping is interfering with her academic progress. And hand flapping in private. Ace is 13 years old and has been diagnosed with ASD. Ace engages in repetitive hand flapping in the privacy of their home, but not in other contexts, though Ace's hand flapping does not generally interfere with the achievement of social or academic milestones. Ace's parents are nonetheless troubled by it and have requested intervention to eliminate hand flapping. So those are the three. So they're looking at all three of these case studies from the perspective of the abolitionist critique, or the abolitionist neurodiversity critiquers, right?
Critics,
that's the word. I was like, what is the word I'm looking for? Okay, so with the first instance, the critique for behavior analysts with SIB is not that it shouldn't be treated, because it should be treated because there's injury involved, but it should not be treated with ABA. Something else should be used with ABA. And what they have recommended in the literature is dialectical behavior therapy. And the interesting thing about that is that the founder actually aligns with behavior analytic principles. So here we're still pulling back some behavior analytic principles to treat that, right? But when you're looking at SAB in developing treatments, the treatment should be built on the person's ability to functionally communicate, to regulate their emotions, and to tolerate frustrations no matter who the person is, right? So here, you're not really looking at a person that has autism or a person that has ADHD or a person that has anything. It's just like, can people, right, in various contexts, functionally communicate what they want, regulate their emotions, and tolerate frustration? So here it takes off the ableist notion of, if anyone was engaging in this behavior, we would want to treat it because we need to be able to give them a way to communicate and to decrease the injury. So this one falls more on the reformist side, right? Because there's straight justification for treatment that's not based on disability, but on the behavior itself. So that one they felt good about. It gets a little less tricky, a little more tricky when we talk about hand flapping. So when they talk about hand flapping, there could be 2 points that hand flapping is part of who Alex is. And so we shouldn't try to a person, or we shouldn't expect Alex to perform at that normative academic standard. So why are we're saying, okay, here's the standard. Why does everyone have to meet that standard? Why can't people go at their own pace?
Sure.
Right?
And why is that the standard?
I don't know. Right? We don't do that for whiteness or maleness or any other positions of power. They bring that up.
But sometimes
they do. Right.
But, very quickly, these discussions, I think, mushroom out to thinking about the educational system as a whole and the inherent coerciveness very often of our educational practices in our country. So you start to, question not only maybe our individualized goals for students, but also what the expectations are for children and students in the school systems as a whole. So why are we asking kids to do what we're asking them to do? And is it unreasonable? Is it developmentally appropriate for their age group? And often I think we come up with these no answers. So the challenge there then is that BCBAs may have to, really advocate for their client to say, I don't think they should have to stop hand flapping, and be meeting up against those expectations in a school system that says something otherwise.
And we'll get to what they can do soon. So I don't think we talk about that yet, because we're just talking about the critique. This is the critique.
Sorry.
Right? Let's not move forward.
Okay.
But yes, because I'm going by the
Sorry.
paper. And so if you are thinking of hand flapping as a behavioral excess that needs to be decreased, then you're thinking of it as part of the autism and pathological, and then that's viewed as ableist, right?
Right, because stereotypy is listed on that DSM.
Mhm.
So then we say, we have to decrease it.
But if you're looking at it in a more holistic approach, which we'll talk about later, it may not be pathological. So this one's a little more gray area.
Mhm.
And then hand flapping at home and problem. I love that they do a whole long thing, but basically it's like, we don't need to treat this. If you do, then you are ableist and you're taking this pathological viewpoint, because hand flapping at home and in private is, we all like to do weird stuff in private, right? So
Yeah, but it doesn't mean that it's not complicated.
sure. Yeah.
As a clinician, if the parents are asking for something, because we also talk a lot about respecting parent
Mhm.
preferences in goal selection, but there may be times where you have to push back against
Right.
that.
You also have the challenge when we talk about restricted and repetitive interests. There's nothing inherently wrong with having a restricted and repetitive interest. I think the issue is there a skill deficit in recognizing that there might be other interests that you as an individual would find rewarding or
Right.
valuable to you? And is it hard for you to engage in those due to the amount of time that you are spending
Right.
engaged in the stereotypy? So there's nothing wrong with having stereotypy at home, but if you find that you are now missing out on other opportunities that you're curious about due to the amount of stereotypy you
Mhm.
engage in, then it might be something that is worth targeting, not necessarily for
Maybe.
decrease.
Yeah,
but
I don't think you target the
you're
stereotypy
targeting
itself.
for the
but you-
flexibility of engaging in other activities.
Yes, right. But then you're not targeting
Sure.
the stereotypy, but you're
Yes.
exposing them to other activities that then may
Well,
ultimately.
your treatment plan may have a target around responding to stereotypy. You're recognizing when you're engaging in stereotypy so that you
Right.
can choose or teach a choice
you can
to
choose,
engage in
right?
other
But
behavior.
I think that's not saying I'm going to decrease
No.
stereotypy, right? You're
Right.
giving
Stereotypy
still-
may decrease as a function of
Right.
you've increased the amount of time you're engaging in other choice making
because
behavior.
you're giving the autonomy to the individual
Yes.
to choose whether they engage in stereotypy or these other things that you've taught them how to do,
Yes.
right?
Yes.
That's
and
the
if you
important
listen
part.
to the autistic community as well, then you hear from a lot of people that self-stimulatory behavior has very clear function for them, which may be really meaningful play, substitute or a different version of play, how we might typically think of it, anxiety reduction, opportunities to work through a challenging situation, in addition to being just like automatically reinforcing how we have traditionally been that behavior. So there are many reasons why someone may want to engage in that behavior. I'm also a really big proponent of leisure sampling and providing people a lot of opportunities to engage with a lot of different things, because without those presentations, they may not find something, like you said, that may also bring them joy.
Yeah. So the authors then go on to ask, okay, we've got this. We've got these 3 case studies. Here's how the neurodiversity abolitionist critiques how here they would see it.
I'm sorry. I jumped ahead.
Go, yeah.
It's okay. I'm sorry.
It's all right. And so they're like, okay, is autism a mere difference or a bad difference? And based on how the science of human behavior works, we would say that autism is a mere difference because behaviors are not explained by internal mechanisms, but by the interactions between people and the environment, right? And so having autism is not wrong. It's not pathological, right?
Yeah.
But those behaviors that we're looking at are just a mere interplay between the context in which the person lives. And so in order to change those behaviors or increase behaviors, right, then we just need to change the variables in the environment, but it doesn't make the person bad or wrong. It's one thing I love about behavior analysis, right?
Yep.
Yes.
Anytime you see behavior that's in excess, that like as a teacher, you're like, oh my gosh. You just think, okay, why is this happening here? Right? It's not like this person's annoying or this person is, right? They're just needy. I'm like, okay, what are the variables at play here to make this behavior happen? And how can I help alleviate some of those variables?
Not to say there's a behavior that individuals may find annoying
Oh,
or
yeah.
find fun, but the individual is not fun or annoying.
Right. It's not the individual. It's the behavior. You can pull it out.
My least favorite is when people say someone's lazy.
Yes.
I truly hate that.
Do you
That's-
smack people when they say that to you, Diana?
I do not.
I would assume you get up in their face and
I
yell
do
at
not
them.
do that, but it's a
Based
teaching
on hours of this
opportunity.
podcast,
She's
you're
a
probably
throat
yelling
puncher.
at them.
She's a
Throw
throat
a
puncher.
chair. Yes, throw a puncher.
Okay, and then they did a really cool thing, I think, is they used an analogy of a linguistic diversity in the class to kind of pinpoint.
It was a good analogy.
Oh, man, this was like, they were like eating their Cheerios and they were like,
Oh, the breakfast table.
yeah, around the breakfast table, and they like spit those Cheerios out. They're like, this is it. So they talked about the African American Vernacular English, which is AAVE. That's the acronym they used, versus Standard English, which they use as SE. And so this analogy is limited in a few ways because language is only one form of behavior, right? Whereas when we talk about autism, there's a wide range of behaviors we're looking to, but it really gets to the point how some behaviors can access reinforcement in some environments and not others, and how some behaviors are wrongly stigmatized, right? So both when you look at the research and you look how language functions, both the Standard English and the African American Vernacular English are linguistically on par. Both, you get what you want when you speak in both. But with the AAVE, there has been some discrimination based on when people use African
Discrimination
American
in the sense of like the negative type of
The
discrimination, not
negative
just the understanding. Oh,
discrimination,
that's
no.
not the same
Nope.
English that I
Yes.
typically use.
a negative discrimination when people use African American Vernacular English versus Standard English. And so there's two ways to look at this. There's the subtractive model where you would add in Standard English. So I'm going to teach Standard English in the classroom, but I also want to eliminate using the African American Vernacular English. And so that home language is seen as a barrier because some will say, right, if you want to successfully navigate this world, you want to use what's more typical, which is that Standard English.
Mm-hmm.
And so it might be necessary to use the Standard English to increase your socioeconomic in the world that we have today.
The perfect parallel to that is saying, oh, we need to decrease this stereotypy because it might be stigmatizing.
Right.
Mhm.
Yep. And so then there's the additive model, which says, okay, you are already engaging in the African American Vernacular English well. You are communicating with your community, you're accessing reinforcers, you're minimizing your punishment. But I'm going to add a new behavioral repertoire, which is Standard English, into the classroom. We're going to use that home language as a strength because in that context, that's where you're going to receive reinforcers. But we're going to add this other repertoire so that you can successfully navigate in various contexts and navigate this world in which you might not receive reinforcements if you're using your home language. So I love that.
Yeah. And then they also, and are you about to say this?
Go ahead.
Sorry.
Go.
Acknowledge some of the limitations with the idea of, and then everything's great. Is now you know when to use this language versus that language, and then that's fine, and the problem is solved.
No, the problem is that even in doing the additive model, there's still the underlying assumption and bias that Standard English is better.
That's what I meant. Yes, that idea that it doesn't capture the whole challenge just by saying, and now that you can code switch, everything's going to be great.
We haven't brought up code switching yet.
Well, that's what that is.
Right, but
what
code
you just
switching,
described.
yes, but we haven't brought up the language yet. So code switching is being able to minimize punishment and maximize reinforcement in your various
setting.
contexts, right?
Yeah.
So in one context, you may use your African American Vernacular English, and one you might use your Standard English, but being able to discriminate between the various contexts in which you will engage in those behaviors.
Yeah. Code Switch is a really good podcast. Also,
I've never heard it.
Yeah, it's good. Yes, so they talked about maybe even with this additive model, you would be teaching this behavioral repertoire, but also part of that educational process should be teaching and understanding that the systems that are in place societally give preferential treatment to Standard English, but we should be working to dismantle those systems as well.
Yeah. So ethically, we're going to move down there because we already talked about the analogy to the case
I just
studies.
love talking ahead of you. I'm
It's
so
okay.
sorry.
It's all right.
I'm just so excited.
They use this analogy to help make ABA healthier. And I like thinking about it that way. So healthier for the clients, healthier to us. So we should be teaching clients to discriminate between contexts when behaviors may access reinforcement or when they may access punishment and they might not want to engage in that. So never saying we're going to decrease a specific behavior, but tailoring the treatment to, okay, here's the time where this is the time to engage in this behavior, and this might not be the time.
Yeah. And if if the punishment that they're encountering is social, then we can also address that as well by working to educate the population that may be providing those punishers to be more accepting.
As part of the training, the BCBA parent and teacher training.
Yes.
In the next section.
So in this regard,
In the classroom.
I think this gets around some of the potential bias that's built into, I'll teach you to discriminate when to use AVE and standard English, in that if we are supporting a client to understand sort of like, in this context, most reinforcement is when you engage in this type of behavior, in this one, and you get to pick which one it is. We also can then include in the treatment plan. And guess what, everyone? You're also involved in this plan. And here's how you can change your behavior to avoid adding punishment for certain times, and ways that you can support the learning and the use of this new skill and make it worthwhile to engage in the use of this skill.
Right. So it's not all, the onus isn't always on the client, right? It empowers the client to make a choice. So you're not saying you cannot engage in hand flapping at school. They're not saying that at all. They're saying, this is where you might contact punishment. Here are some other things that you can do at school that may contact reinforcers. Hey, everyone that's involved, here's the choice. If they choose to still do that, we're not doing a great job in the environment to modify, because it could be stressful, modify the environment to fit them, right? It could be boring too, right? So I love that it's not just, the onus is not just on the client, but we have to educate our listeners, teaching those neurodiversity affirming principles, aim to be the neurodiversity advocate.
Yeah.
I love that, right? And teaching the people around us that all functional communication responses are valid, not just the one that you expect to get, and that the functional communication can be a good one, even if it's different from everyone else in the class, how they would access something. And that's okay. It's not less. It's great. Yeah. So they also say that we should try to avoid medical terminology whenever we can, because that medical terminology can uphold ableism. So that may also mean having discussion with insurance companies and medical offices to support that change. We may need, behavior analysts may also need to code switch, right, when moving between clients and discussing with medical companies. So that's not going to change anytime soon, right? If I call the insurance company, I'm like, what I'm writing is ableist and I refuse to write it. They're like, you're not going to get paid, right? So I may need to discriminate in what context I write goals and objectives, and how I can translate those goals and objectives to be strengths-based.
And I would say, if you are in a position where you are not beholden to some sort of like group, and you can get up in their face and say, I'm not cool with this, it's ableist, I would like us to do something different, you should do that.
Yeah.
Which is not everybody, but if you can,
do it.
And you probably know if you can, because you've done it, and hey, you still have a job, or hey, you're still getting paid, then you should.
Yeah. And so I love how the article ends. It says, the ethics code has done a nice job moving forward, right? That we should do no harm, but do no harm is kind of loaded. Right? Because we have to think about the client. We have to think about what that harm might be, depending on how we are viewing our treatments. And the ethics code doesn't really say anything about the aims of treatment. So they say, the code states that we should maximize benefits. But when you look at it in terms of social validity too, we can't really use social significance, right? Because that may be problematic, as we talked about before, because it's probably going to be ableist. Right. So it's going to be important to include the client and not just regard the normative society. And I just love this article. It felt real. I don't know. It was like this. It was academic, right? I think it was an academic article.
Yeah.
I loved it because I felt like
approachable, though. I think they did a really good job.
The word abolitionist was scary to me when I first saw it. And I was like, ooh, I don't know what this term is.
When someone says I'm an abolitionist, I'm immediately like, I also agree with no slavery. And the idea that they're like, oh, I have to disagree with the abolitionists? But wait, what? That it is I
didn't even put those two and two together.
It is a context I really struggled. I was like, abolitionist, that's a good thing to be an abolitionist. And then reading them, it's like, no, I need to disagree with these abolitionists, but not disagree with them so much as listen, take what I'm hearing, and then change my own behavior in the hope that I can, continue to create a science that is of maximal benefit to everybody, not just to subsets of groups who have more or less power.
All right.
It's a term that makes you want to take sides.
Yes.
Oh,
and
yeah.
I think that's not
that wasn't the purpose.
Ultimately helpful.
Right.
in the conversations that we need to have as a field.
But the Graeber and Graeber did not make that.
Oh, no, I know.
They
I'm
didn't
not
make
blaming
that.
them.
So
Yeah.
I did not look into the origin of abolitionist neurodiversity. Is the idea that individuals who use ABA have been engaging in like a metaphorical
Abolitionist just means you
slavery?
want to do away with something.
Yeah.
The abolition.
Oh, but it's my own historical context of the only time I hear that
Right.
term is
Right.
in reference to Civil War era America.
Right.
Okay.
Right. You could be calling for the abolition of lots of things.
Mhm.
Mhm.
I tried to do that with hand dryers in the bathroom.
You don't like hand dryers?
No,
Huh.
too loud, but it didn't work.
Hmm.
So they're still around, but
Hmm.
it was a one woman movement. So
Oh, well.
I love them, actually.
Well, let's move into the dissemination station. No hand dryers on this train.
fair
It's
enough.
just wasteful paper towels.
No, there's nothing. You're just
Just
using
like-
your
Yeah,
pants.
use
yeah, just your pants.
Everyone's got wet pants, and someone snuck some paper towels on. They're all kind of crumpled up and let's get off. We got to clean this train.
Yeah.
It's a new year, new train. So my challenge in these articles is not a challenge in that I disagree with anything that is in either of them. I think it is the challenge inherent in when you got about 5 articles published in behavior analytic journals on this topic. They both are breaking a lot of interesting grounds for discussion, but also they're not getting to where we need to
Where you
go.
want to be, right?
And-
You're looking for action.
Yeah,
We're not
I
there
want to
yet.
get to action. And I think we have some action. I think there's
Yeah,
definitely
that's true.
some action here. And I think we're also in a very specific subset of behavior analysts that want to read and then immediately talk about what to do next. And when you don't have that closure, that can leave you feeling a little let down. Again, not by lack of quality, but just the lack of time that subjects like this might take to have fully formed discussions and to make shifts in policy or procedure.
I mean, I've been thinking on this topic for about 2 years now, and it takes quite a while to work through, in my opinion, your kind of the varying stages that one needs to with respect to your own background, upbringing, potentially ableist biases, guilt regarding your past practices, reasons for coming into the field, right? Thoughts about why you want to defend what it is that you do, and move yourself through all of those varying things to get to a point where you still feel that there's good to be done by our field and our science, and I do. And
Oh, thank goodness. I was going to say.
Nope, I'm there.
Bad twist at the end of the
And-
show.
That is like, and I quit.
I'm out. No, but I say that, cautionarily, because I think that there is a lot that needs to change. And that's coming from me, who I think I have a strong background in this, and I've had, the time and luxury to think about this and respond to some of these changes, in that I've been in this field for a long time, right? And other folks who are just coming into this field are getting wave after wave of this information and maybe are really confused and not sure where to turn and what to do.
Do you have all that student loan debt and now you're rethinking, oh no, I'm in a terrible, hurtful field. How am I ever going to pay this off?
Yeah.
Yes.
Yeah.
Don't. There's a lot that can be beneficial through ABA, but you're okay to be concerned because that means you are thinking and reflecting.
Yes. And so, there's all different camps that are trying to respond to this. Some people are responding by like doubling down on what it is that they've always done. Some people are responding by leaving the field. Some people are responding by, moving toward their versions of neuroaffirming care or neurodiversity supporting treatment, quote unquote treatment, which we didn't even talk about as an ableist term. But there are, criticisms and critiques as well of people just slapping that label on their services and not actually doing the deep work necessary to look at whether their practices are ableist or are working toward indistinguishability or are not listening to autistic voices, which again, it's a lot to sort through. And we barely touched, Rob, on the important point that you made of, autistic voices are not a monolith, right? Every person should be coming in with their own individual perspectives. And we have a huge challenge before us to attempt to determine what the perspective may be for someone who can't tell us. I think that we want to be listening, of course, to the autistic community. How am I to know what my client wants, right? Like, I have some glimpses there, but listening to someone who may share some neurology that I do not can most certainly give me insight. I'll have to, again, attempt to determine whether it may be the same or different for my client, but let's err on the side of the same, right? If I can't actually tell. But that's a hugely important conversation to have and to take into consideration here. So there are so many pieces of this. We have barely scratched the surface. Any one of these talking points that we had today, we could revisit on its own for an entire additional hour and still not get to the bottom of this, because this is a real critical issue for our field. This is compounded by the just absolute astronomical expanse of our field over the last few years. And with that, we've brought in lots of different, training practices and supervisory practices, some of which maybe do not talk about this or talk about the ways in which one might determine client preference or whether goals are appropriate or whether we are practicing neuroaffirming care in the same ways that other programs might. And the expansion of our field has also brought more attention to it and unfortunately provided examples in which people are not doing this type of practice or who do not seem to have the nuance of understanding of behavior analysis to operate properly according to our science, but rather, like I said before, are using outdated and ill-informed applications of the science in our field. So I don't have all the answers, but I think it can take a while to work through them. So if you're just at the beginning of that journey, that's okay. But you got to stick with it and do the work and go through the hard parts to get to a point where you can, sort out what's to keep and what's not.
Yeah. Can I throw out some potential action steps? Because you know me, I don't like to end a show unless there's something someone could listen and say, I will do that. I have something I can definitively do. Because we also don't want people to listen to this and then just be like, and then you can sit. While there's a value, I think, in sitting in uncomfortable emotions, at the end of the day, we're hoping your value is supporting the rights of individuals and making the world a better place according to the needs of both the individual and everyone else at the same time, that kind of semi-paradoxical sounding group. So we want to make sure you have something that you can do to act towards those values, which is going to be, in my opinion, I would say when you are creating a plan, maybe, I was going to say treatment plan, but you're right, Dinah, maybe treatment plan is not even the right word. When you are going to be working with a client on skill acquisition, ask yourself, am I making a goal that is important for my individual client? Or am I creating a goal that is important for everybody else? That's just an easy question you can ask yourself. And if the answer is I'm not sure, then reflect on it. If you still think you're hopefully coming up with a goal and a plan that will support everybody's best interest, how are you going to measure the social validity of that step? Are you using concurrent chains? Are you able to use a Likert scale and just do some questionnaires? Are you able to build choice into the plan itself? And then you'll have a better answer of, is this beneficial to everybody, to one group, to the group that is kind of trying to promote ableist principles, to the individual client who should be your top priority? So that, I think, is a good first action step. How am I listening? How am I doing my own listening? You don't necessarily need to be on a Facebook group. You could just be listening when it comes to the individuals that you are purporting to support. And I don't mean purporting condescendingly. I mean that I hope you are supporting them, but that is your goal, is to support them. That's my thought as kind of an action step. Sound okay?
Sounds great. I can't wait for part 2.
Well,
which will not be coming out next week.
It's not coming out next week.
It's sometime in the future.
No, but it's one of those episodes where we finished kind of starting and said, we got to do another one of the. Sorry, I made it sound so begrudgingly. Oh, we're not going to get it all in the one episode.
No, it's just a huge topic. We got to do another one. And probably the most important one, I think.
Yep.
For our field.
So it's in the section of episodes we are going to come back to.
Okay.
Well, that brings us to the end of our episode, our discussion on neurodiversity. But before we wrap up, Before we wrap
Snap into a
up,
Slim Jim.
you want to? Is that the pairing?
No.
Let's go to pairings. And the
Okay.
pairing is Slim Jims.
It's not.
Da, 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 da. It's time for pairings, everyone. Pairings is when I tell you about other episodes you might want to check out if you thought that this one was thought-provoking. Turns out we have a ton, which I am actually quite proud that we have a lot of things that touch on this that you could go back and listen to. So if you're interested, you could check out episode 134, which is titled Trauma-Informed Care. That was with Brian Middleton. You might know him as the bearded behaviorist. He's an autistic BCBA. Episode 204, Applications of Trauma-Informed Care with Dr. Adityan Rajaraman and Dr. Jen Austin. Episode 160, Incorporating Unique Interests. That was with Tamika Meadows. Episode 165, Quality of Life. Episode 219, which was a call to action on Rakers and Lovas. That was with Sarah Kompow and Dr. Matt Cipriati. Episode 235, The Lack of Ethics in Conversion Therapy with book club guy Alan Haberman. Episode 236, Assent and Self-Determination with Dr. Haley Steinhauser and Alex Kishbaugh. And also 2 book clubs, episode 1001, which is the Neurotribes book club, and episode 1004, Look Me in the Eye book club. Any of those you should go back and check out if you thought this was an interesting conversation. And then also for pairings, I also like to recommend a snack that you could listen to, that you could enjoy.
You could listen to it first
You
before
could,
you eat
I
it.
guess, but most people don't.
Have a mindful moment while you eat this snack. Just listen to myself. Let's all make mouth sounds, everyone.
Gross.
Everyone loves that in podcasts.
So my snack recommendation today is ribs.
Gross.
Why?
You want to know why?
Yeah.
No, not really. Let's end the show.
Goodbye, everyone. No, ribs because 2 reasons. First of all, not everyone wants to eat ribs, right? It's a personal decision.
I never want to eat ribs.
It is a personal choice. I don't either. It's gross.
I don't always want to eat ribs, but sometimes I
But
do
some
want to eat
people
ribs.
do, and some people really like them, right? So this is a goal that should be approached individually, whether one chooses to eat ribs. Now, let's say you do choose to eat ribs. You also may choose to eat those ribs differently in different settings. So if you're at home, right, you might really dig into those things. You might get real messy. There might be like barbecue sauce all over the place. If you're at, I don't know, a fancy dinner that's happened to serve you ribs, you may approach it
the
differently.
Queen's ribs.
The Queen's ribs. Then you might, eat them a little bit more daintily as well. So there are decisions to be made with whether you approach eating ribs at all, and then also potentially discrimination across settings with how one should eat those ribs. So perhaps you can think back to a parallel discussion that we had previously, not related to ribs, but related to those 2 factors. And then, of course, just to go with ribs, I wanted us to all have some French fries because not everyone likes French fries, but I've probably approached pretty close to the perfect food by recommending French fries. But if you don't like French fries, it's also still okay.
I love French fries, but I can't eat them.
French fries are good.
They are good.
There you go. And that was pairings.
Thank you,
Da-da-da-da.
Diana. Thank you. All right. Well, that brings us to the end of the show. A couple things before we wrap up. Certainly want to make sure you get that second secret code word. It is Wonka. 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 Wonka, the amazing chocolatier. Perhaps you saw the movie with Timothée Chalamet.
I haven't.
No, I haven't either.
Maybe by the time this comes out, I will have. I don't know. I'm like almost a little bit nervous. This is my code word recommendation because I love the, quote unquote, original Willy Wonka. And
This is the original movie version.
The movie version. Yes, not the book, the movie. And I have seen that thing so many times. And I think I can quote it from start to finish, most likely. I would love to talk to you about it for a long, long time, but I won't right now. Wonka.
I have no intense interest.
I heard it was the same director who made the Paddington movies, which did make me interested. But then I thought, wait a minute, I could just rewatch the Paddington movies
Rob
instead.
loves Paddington.
Paddington 2.
Rob loves
Pretty
Paddington 2.
Awesome.
Bye.
All right. No, we can't bye. We got to do some other things. We want to say thank you all for listening. Please remember to rate, review, and subscribe. We are all over social media as ABA Inside Track. You can go to our website, abainsidetrack.com, to find links to all of the articles that we discussed, as well as links to all of the previous episodes in pairings and just other previous episodes that we've done. You can also subscribe for a little extra ABA Inside Track content, including some extra episodes, free CEs, and discounts on our CE store. Subscribe on Patreon, patreon.com/ABA Inside Track. If you subscribe now at the $5 level, you'll be able to vote on our winter listener choice episode. That poll is coming out pretty soon. And if you subscribe at the $10 level, you'll be listening very soon. Actually, it may have already happened. I don't have my schedule in front of us, to our discussion on the new Act for Behavior Analysts book by Dixon, Hayes, and Belial. That just came out, as well as all of our other book clubs. And all of those come with free CEs just for being a patron. As a big thank you, patreon.com/ABA Inside Track. And some final thanks to Dr. Jim Carr for recording our intro and outro music, Kyle Sturry for our interstitial music, and Dan Thabit of the Podcast Doctors for his amazing editing work. We'll be back next week with another fun-filled episode. But until then, keep responding. Bye.
Bye.
Bye.